Good morning, Dr. Ida Khanum from Pediatric Pod Concierge Pediatrics in Bel Air, Houston, Texas. Continuing on my topic about colic, so what causes colic? I think that is one of the big questions out there, and people are constantly looking into finding out what may be causing colic in a baby, because it usually happens after the age of 3 weeks and can last for about 6 weeks to a month to 2 months. Parents, as I said, they look and they see there's a pattern of this crying, and they can't really figure out the cause. And to this day, we're still not able to figure out the cause. I think there are studies being done currently to seeing if the baby's gut health may be affecting or cause colic. It's like a crampy, colicky pain, and they have, and we'll talk about treatment options in the next video. But I wanted to come on board and say we're really not sure what causes colic. It happens just randomly in some babies, and some babies don't have that problem. But you really find out once you start seeing a pattern of the crying, and we kind of go through a history. If the baby's breastfed, has mom been having any specific kind of foods? Has there been any change in her diet? If the baby's formula fed, have there been any changes in the formula, the type of formula, the water that they're using, how they're feeding the baby? Is the colic related to shorter burping times? Has the person who's feeding the baby changed, because maybe the way they're feeding them is a little different? Are they letting the baby cry more? Is there like a big gas bubble in the tummy? So you kind of go through all of these, you kind of go through a good history and figure out if any of those things may be different. But most of the time, there's really no cause. It starts and then it goes away just as it started.